Could you be wasting thousands of dollars because you are paying unnecessary out-of-pocket costs for your health care? Well, here to tell us how ignoring high levels of body fat, cholesterol, blood pressure, and blood sugar can result in preventable costs is Jackie Aubie, a health services expert. Good morning, Jackie.
Good morning.
You know, this is very interesting. Tell me about this study that was just done, this survey.
Yeah, we're pretty excited about this study because we're very focused on helping to improve affordability for health care in the U.S. And we conducted this study and found, it was a 3-year study, and we found that there are 4 factors that are correlated to health conditions in the U.S. that are more manageable and can also drive up your expenses if you don't manage those expenses, or if you don't manage these conditions.
Well, and that's so interesting because I think we're so worried about, you know, everyone wants to save money. We all, of course, want to be healthy. So describe what these links are and what are people missing the boat on? What are we not doing?
Sure, absolutely. So the 4 conditions are BMI, which is body mass index, and that basically is an indicator as to whether or not you might have a weight problem. A blood pressure, which is if you have high blood pressure, it can lead to hypertension, which can cause strokes or other related conditions. Blood glucose levels or blood sugar levels, which are indicators of diabetes. And cholesterol. Cholesterol can lead to heart conditions. And so if any one of these 4 areas goes unmanaged and your numbers are elevated, it's going to cost you more money. In fact, in this study, we found that individuals who had one of these conditions are spending on average $300 to $500 more out of pocket a year, and individuals who had 2 or more of these conditions unmanaged were spending $1,300 on average more a year. So that's a lot of money.
Now, when you say unmanaged, does it mean that people knew that they had this but didn't do anything about it, or did they really not know that they were at risk in any of these areas?
Yeah, well, we actually saw in the results that individuals who were aware of the condition, if they're actively taking action, they can actually improve their situation. But the worst scenario are people who don't even know their numbers. So these are individuals who haven't even taken the step to go see their physician, to get their annual physical exam, to understand where they stand on these particular health areas.
And why aren't people doing that, do you think? Are they nervous about the results? Do they think that they just don't have time? I don't know. Did you guys find a reason?
Yeah, we didn't actually find a specific reason in this study, Carly, but I do think that some of what you mentioned is probably true. And maybe people just aren't aware of the fact that all health plans now cover preventive visits, at least one preventive visit a year at 100%. So if finances are a concern, it's something that they shouldn't be concerned about. If they have health coverage, they can go get their annual visit, and during that visit, ask their physician to give them their numbers in these 4 areas.
All right, so is that the take home then, you know, to make sure that you go and get that? And again, as you said, most companies will cover that exam, you know, once a year. We can all do that once a year, right? That's not too bad.
Absolutely. People have to find time to do that once a year. And then if you find during that visit that any one of your numbers is elevated, the other thing is to make sure you take advantage of the programs that your health plan offers. So at Cigna, for instance, we have licensed clinical experts that are at the ready to help individuals who are motivated to improve their BMI or their blood pressure or their cholesterol. And these people are experts in behavioral modification and helping individuals stay motivated. If that's not your cup of tea and you'd rather do it online, we also have online health management programs that, in effect, to do the same thing without the aid of a live coach. And then there's always the option of using some of the health apps that are becoming ever popular today, which we can connect you to. And those health apps usually come with wearable devices that are gaining some popularity so that people can monitor their health.
All right. It just seems like a win-win all the way around for employees or for employers, for people who are wanting to live healthier, you know, for those who are wanting to live longer and be healthier for our kids. There should be no excuse. Knowledge is power, right?
I agree. I agree. And one other factor that might be one added motivator, many employers are actually putting up money paying for their employees to actually take part in these programs. And they do that through contributions to their health funds or through lowering their premium. We paid out $80 million last year through these types of incentives. So check to see if your employer offers some of these incentives.
All right, so true. Well, any one website you want to send us to for more information before we let you go?
Absolutely. Go to Cigna.com, Cigna.com/knowyourbenefits.
All right, thank you so much, Jackie. Very interesting.
Thank you, Carly. Have a great day.
You too.